Should we be preparing for a new wave of coronavirus? The World Health Organization says EG.5 is a variant of interest, but there's no need to panic. However, they're not ruling out that new variants may be more dangerous in the future. So how far is COVID really behind us, and have we learned enough to cope with another pandemic? I'm Andrea Sankey, and today's newsmaker is COVID-19. In May this year, the World Health Organization declared that COVID-19 was no longer a global emergency. It was a big moment, as the pandemic that broke out in March 2020 had caused massive social and economic disruption. Although not everyone was infected, almost everyone was affected. We all stayed home, wore masks, and witnessed various hospitals and morgues fill beyond capacity. Now, the virus killed almost 7 million people globally, and more than 700 million cases have been identified since the virus was first discovered. And now, just as life gets back to normal and all rules are relaxed, a new variant of interest is being reported.
EG.5 is one of the sublineages of Omicron that is in circulation. It's a descendant lineage of XBB.1.9.2, and it has the same spike amino acid profile as XBB.1.5. In terms of its behavior, it has an increased growth rate, as we expect all of these sublineages that are emerging. We don't detect a change in severity of EG.5 compared to other sublineages of Omicron that have been in circulation since late 2021. What is important is that today we will be classifying this as a variant of interest. It was a variant under monitoring.
Also known as the Eris variant, it's now become the dominant strain in the U.S. and the U.K. Current vaccines do appear to have some efficacy against it, but in the U.S., health officials are preparing a booster dose that will target the new strain. But that doesn't mean COVID is gone. The WHO says there is still a risk that a relaxed approach going forward may not be the best way.
The number of countries reporting data to WHO has also declined significantly. In the past month, only 25% of countries and territories have reported COVID-19 deaths to WHO, and only 11% have reported hospitalizations and ICU admissions. WHO is currently tracking several variants, including EG.5, for which we are publishing a risk evaluation today. The risk remains of a more dangerous variant emerging that could cause a sudden increase in cases and deaths.
So while the battle against the virus has been ongoing, a parallel battle was and still is being fought. As COVID cases rose, so did conspiracy theories, some of which smeared and discredited doctors and proven medical science. Now, some claimed the vaccine was a tracking device implanted by governments to control us. Others said governments were deliberately orchestrating a global genocide. While the initial turmoil has died down, it has not died out. According to The Guardian, a quarter of the UK believes COVID was probably or definitely a hoax. That's largely because people like this anti-vaxxer have spread that message.
I mean, we have people to this day denying that the vaccine is killing people. So, we have people at the beginning who were, freaking out because they had some illusions of people falling in the street and all this kind of nonsense. And they were caring about the death, right? Oh, they're going to die and we better do something and this kind of thing. But now people are really dying and nobody's saying a word, and then you go to the doctors and they'll say, oh, we don't know what it is. We don't know why their heart just suddenly stopped. We don't know why they have all these blood clots in their eyes and these sort of things, or why people are rapidly aging, or the sudden rise in cancers.
So the worst of the pandemic may be over, but the conspiracy conversation is still out there. Joining me now to talk more about what's been learned and what may be ahead, as well as the new Eris variant, are from Geneva, Dr. Margaret Harris, spokesperson for the WHO and a clinical epidemiologist. From Seattle is Dr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security and an adjunct assistant professor at the School of Public Health. And from Paris, we have Oksana Pyzik, Senior Teaching Fellow at the University College London School of Pharmacy. Thanks all so much for being with me. Margaret Harris, I'll start with you, and let's begin with this new variant. Yes, COVID has mutated again. People are getting sick, but fewer people and much less lethally than before. So how concerned should we be?
So the reason we're mentioning it, we're talking about it, is we track thousands of variants now. There are now thousands of variants of the SARS-CoV-2 virus, but this one has shown an increased prevalence. It first started showing up in increasing numbers in Asia, in China, Korea, Japan, and it was associated with an uptick in cases. And now, of course, we're seeing it in the Americas and in Europe, and we're getting reports from 29 countries. No, sorry, apologies. Reported from a total of 48 countries, but we're getting more reports, and we've seen the prevalence go up to 17% from 4% in a matter of weeks. So that means it's got a growth advantage. However, the good news is where we've seen a big rise in numbers of cases, we haven't seen a rise in severity. So we're not seeing the intensive care units filled up. We're not seeing the hospitals filled up. So that's why we've said it's a variant of interest, but at the moment we're designating the risk as low. Okay.
Dr. Adalja, what's I find so interesting with COVID is that it is so active even in the summer. You know, when people spending time outdoors in warm weather are not expecting to get sick. Why is this different? Why is there this summer spike? And then how worried should we be then about this coming winter? We have millions of kids returning to school very soon. And we're hearing about this triple threat as well with RSV, the flu, and COVID all active. So sorry, multifold question for you there. But yeah, why the summer spike and how worried should that make us going into winter?
We don't have a full understanding of what causes the summer spike, but in the United States, for example, we've seen it each summer. And the leading hypothesis is that it gets very hot. People go indoors where the virus spreads more efficiently, and that may be what's happening. It doesn't appear that this is related to anything new with the virus, even though new variants appear, because it's something we've seen. And we know indoor transmission is higher. In the fall, we know that transmission is going to increase for the same reasons as people go indoors, and that will also likely coincide with influenza and RSV seasons. And I think that's the norm, that we're going to see COVID-19 become a seasonal virus. It's taking some time to dampen its ferocity down, but it's clearly becoming more and more manageable and looking more and more like other respiratory viruses. And I think it's important when you talk about the other respiratory viruses like influenza and RSV that we have tools now. In the United States, we have vaccines approved for RSV for the first time ever. We have flu vaccines, flu antivirals, the same thing with COVID vaccines, COVID antivirals. So it's something that we're going to contend with in perpetuity. But it's also something that becomes increasingly more manageable as science and technology deliver us new tools.
Okay. Oksana Pyzik, as we talk about those tools, I mean, how much do boosters now still matter? Even though the virus has changed and they're trying to adapt the vaccines to keep up, is it crucial, do you think, that people get boosters at this point, or only if they're more vulnerable?
Well, I think that certainly we need to prioritize the most vulnerable first so that they get priority access. And it's unfortunate to see the delays with the monovalent XBB 1.5 type of booster that would be better protective than what's available now. Was supposed to be ready in August, but in the States, we're looking at it being bumped not even in September, but October. So then we're behind, in which kids are already back in school, and it puts us in a more precarious position for a tridemic of all the other respiratory aspects. So boosters are super important, as well as the development of them in a way that's strategic, that we can get ahead before we get into the fall season. So that's one aspect. I think it's important that we're on course to delivering that through pharmacies, through clinics, making it as accessible as possible, and ensuring that people are aware of that. I think there is a complacency for the rest of the population.
All right. Dr. Harris, let me turn back to you, and let's talk, if we can, about what's been learned now that we've had some time to digest the worst, the peak of the pandemic. Do you, as a doctor, feel we're better off and better prepared now that we've had the experience, or is COVID actually kind of still too controversial to be managed without, a level of public outrage?
So I think we've learned a tremendous amount. And what was critical for me was the speed with which the scientists work and how well they worked, the collaboration, the solidarity they showed. They shared information, they shared discovery, they got the tools. Now, where we failed as a people is with solidarity. We failed to share with the rich, as they've done throughout human history. Grab the tools, grab the protection. And then you mentioned earlier, it's also been an issue with misinformation. Unfortunately, in societies where things were actually being done quite well, people almost threw the toys out of the cot and didn't make the most of the fantastic things that were offered. We anecdotally heard of people who were dying in intensive care and saying, yes, but at least I didn't get vaccinated, which is just bizarre. So we've got a lot of work to do to understand how to get a clear, trusted message across and help people to take the actions that they need to help themselves. And the other big area of learning that we really haven't paid attention to is we need strong health systems with a well-supported, well-paid, well-trained health workforce in absolutely every part of the world. We really failed on that front.
I mean, it is frustrating because we should have learned how important it is globally to have doctors and nurses at hand that are ready to deal, with medical emergencies on this level. And instead, we're seeing nurses on strike. The pay is still, in so many cases, just, less than coffee shop workers. We've actually seen statistics that say. So yeah, that is definitely a lesson to be learned, and I don't think it has been yet. But Dr. Adalja, let me turn to you, because I actually want to take a quick look at, how the topic is being approached by some, and I'd like to look at a sample quickly from a news channel in the United States, a right-wing news channel, I should mention. The anchor is actually asking Dr. Brett Giroir, he served as Assistant Secretary of Health under Trump, about the potential return of masks as a measure of prevention. It's really interesting to hear how it's portrayed as a political issue. And I'm talking about the lessons we should have learned. Let's listen to just how this question is phrased.
Doc, I can't help but think that sort of this excitement to bring back COVID, pandemic, restrictions, on and on, has a lot more to do with power and politics than it does with a mask is going to save you from getting COVID that is now much like the cold.
Yeah, doctors haven't spent their careers wearing masks for nothing. So, Dr. Adalja, why do you think it's still being interpreted as some kind of political tool? To what end would people use it? Anyone use it as a means to project power? Just a simple mask as a tool for prevention?
Because the politics around masks is powerful. It's powerful for both sides. It became politicized, and then you have two tribes in the United States that kind of seize on anything to get one up on the other. So now it has become something that you look in the United States. Almost everything now is looked through the lens of what political tribe you belong to. And masks got caught all up in that because the whole pandemic became politicized from the very, very, very beginning. And now it's not something where you can give a recommendation. It's, are you giving a Democrat recommendation or is that a Republican recommendation? And that's a very dangerous precedent, because when you talk about science, when you talk about medicine, it should be above that or more important than the petty politics. But what's happened is both parties have seized upon that, and it's made it very, very difficult to actually do anything when it comes to, for example, CDC recommendations or what happens in hospitals. All of it has now become the purview of politics. And that really poisons it, because what we need is a proactive approach, one that is nonpartisan, one that actually looks at health security almost as a national security threat, or on par with that, so that we have sustained budgets, that we don't have boom and bust and panic and neglect cycles. But what's happened is Washington has kind of taken a hold of these issues and made them into this political theater. And you've got these two tribes that are it's just red meat for them to take these issues completely out of their context. And I think it's a hugely dangerous precedent that is going to come back to haunt us if we are faced with another, or when we are faced with another pandemic that is more severe.
Yeah, you say when. So, I mean, what is your biggest fear then? Because of something as simple as a mask, as I said, doctors haven't been wearing them for decades for nothing. There is a level of prevention. It might not stop any virus from spreading completely, of course not. But I mean, if it's something that simple can be turned into something this big of a political debate, as a doctor, what are you most scared of should another wave of coronavirus or some other virus cause another pandemic?
Well, what I'm scared of is the breach that's occurred between infectious disease physicians, public health practitioners, and the general public, where everybody thinks everybody else has an agenda, and they really doubt that people are actually trying to solve a societal problem, such as a pandemic or an infectious disease emergency. That's what I'm worried about, is that there's just complete distrust, that there's going to be Republican science and Democrat science, and they're not going to actually coincide with each other, that people aren't going to recognize that scientific facts are objective, and that there are ways to use reason and logic to develop tools that are going to be effective to prevent people from getting sick. And I think that's the danger, is that this now has become something that isn't considered reality. It's something that is, as you said earlier, some people think that the whole thing was a hoax. All of that is really, really dangerous. And some of this did happen during 1918. We did have anti-mask leagues in 1918, and there was a lot of people spreading disinformation in 1918. But it took about 100 years or so before we had the next major pandemic. We had smaller pandemics in between, but we don't know when the next pandemic might strike. And if it happens anytime in proximity to COVID-19, all of these same political forces are going to really rise up again, and it's going to be even worse because they are on steroids now.
Oof. I mean, I can see everyone on the panel here agrees. Oksana, how much damage do you think now has been actually done to the reputation of vaccines themselves just because of COVID? I mean, there used to be very few questions asked about the tried and tested ones, not least polio. And now we have people questioning basically everything that we've been using for almost close to a century now in some cases. To see that kind of doubt raised, I mean, what does that mean to a doctor as well?
Well, I think that what we're seeing is that there's a reluctance towards routine childhood immunizations, which means that there has been a comeback of measles and other infectious diseases, because that protection is declining over time. And that's extremely worrying to see. We need to ensure that we engage even more with the population on this issue and do more to explain the benefit. Unfortunately, scientists are up against entertainers, much like Joe Rogan, who has the most popular podcast in the United States, which goes unfact-checked. So scientists, public health experts, journalists, they all have a tremendous new challenge to face. However, I'd also add that with the face mask issue that's become so polarized in the United States, while that is, I would say, true to some extent in other countries, I think it's even more so the case in the United States. It is in other countries, you will see that it isn't a party issue, that some people even who have had firsthand experience with SARS, so if we're looking in the Asian region, that face masks are, culturally used during, just like respiratory hygiene, during months.
Exactly.
And in other cases as well, there is less judgment of it. You don't have the same shaming. But it doesn't mean, like, globally, we still, I think, on the defense line, need to be talking about ventilation, because yes, we need boosters. Face masks are a useful tool, but what has been neglected by many governments, and this is not just to reduce the burden of COVID, this would help with any respiratory disease. It's just like we have clean water, we need clean air regulation in public office and spaces to include breathing in filtered air.
Understood. Dr. Harris, let me come back to you because there's one other issue I wanted to look at as well, because this controversy is also still active, and that is over where the virus actually originated from. As health authorities, at the WHO, do you want to know where it came from? Does it matter from a health perspective? Or is it something that is just caused people more to question, our doctors and our scientists, whether it came from a lab or from bats? Does it actually matter in the long run? Because people are still talking about it, and they think it's actually proof that there is a conspiracy behind this.
It matters a great deal. And it is something that we definitely want answers to. Now, one of the struggles is for any virus, any infectious pathogen, it takes a long time. We still haven't really completely nailed down where the first SARS came from. That was the SARS that we saw in southern China and Hong Kong back in the early years of this century, 2002, 2003. Now we pretty sure it's among the civet cats and the mammals that were sold in the wet markets, but it's not 100% sure. So but it's critical, because if you know it's coming from a particular group of animals, if you know what the practices were that led to that, you can prevent it. And that's everything. And again, settling this debate is crucial, not just because for prevention, but also because indeed we've got this massive swirl of conspiracy theories that are reducing trust and are going much wider than that particular question. They're polluting everything else. And all the studies show that in countries that did very well during their large outbreaks of COVID-19, there was big trust in the population. So that was the most important factor. So you lose the trust of your population, you lose the ability to help people to protect themselves. And that's what we all want to do.
Yeah.
Help people live.
Dr. Adalja, okay, so I imagine your opinion as well is you would like to know where it originated from, so that it can even be addressed at the most basic level in prevention of the next pandemic. But how much has it gotten in the way that the actual origin of this pandemic has also become a massive political debate?
Well, I agree with Margaret that this is a critical issue because it changes how we prepare for the next pandemic. But what's happened is, because of China's lack of transparency, and the Chinese government doesn't even acknowledge that it could have come from the wet market. They actually still hypothesize that it came from frozen food from the United States, this preposterous idea that they put forward. That what it's done is give an opportunity for people to go into their political camps and then use that against each other, especially because there are questions about funding from the NIH to the Wuhan Institute of Virology that have kind of catalyzed major hearings in Washington. And this is just more of the same. The more uncertainty there is, the more lack of transparency, it gives rise to conspiracy theories, which then get sucked into the politics of the day. And that's what's happened. And now you have people threatening a lot of research agendas because of what happened, what may or may not have happened at the Wuhan Institute of Virology. And the only way we're going to figure this out is if China actually comes clean and talks about what was going on, what viruses were being studied at the Wuhan Institute of Virology, what types of experiments were going on, what was going on in their lab biosafety, as well as understanding what animals were in that market and understanding the role of that market in expanding COVID-19. So all of that uncertainty, all of this kind of shifting sands here of where this came from just provides more fodder for the conspiracy theorists, as well as people that are in politics that are going to use this to score points on each other. So I think it all just feeds on each other in this vicious cycle.
Okay, Oksana, I can give you one final minute for your final thoughts. Go ahead.
Well, just to also add on to the fact that we need to have answers and that the work of scientists in order to rebuild trust with the population starts in one way with the origin aspects and is critical to the success of investment in prevention. I think one of the key messages is that we should not be taking back our screening programs or winding them down. If anything, we need to ensure that our monitoring and surveillance is maintained and investment continues in this area for us to be able to respond as quickly as possible to reduce things like long COVID, which unfortunately medical community still is struggling to fully understand. And there is rejection of this concept politically as well.
Right. Indeed, we could have an entire separate program on just long COVID and what's been developed with that. But Oksana Pyzik, you will have to have the last word because very unfortunately we're out of time. For this edition of The Newsmakers, I'd like to thank all three of my panelists sincerely so much for being with us, and our viewers, of course, for joining us as well. Remember, you can follow us on Twitter, and do be sure to subscribe to our YouTube channel. I'm sorry, that's X. I'm Andrea Sankey. We'll see you next time.